we will introduce a section on the applications of especially hyaluronic acid and other components from the extracellular matrix. Capucina presented in a very elegant way the trend in extracellular matrix biology, so I go further here. And surely we need to consider the association between the macromolecules that are present in the intracellular matrix and the associated disease and the intracellular signal transduction cascade that are induced in growth, motility, adhesion, invasion, dormancy, and eventually metastasis. Here we will focus more on the hyaluronic acid properties and on the studies that we are carrying out at the School of Health and Physical Exercise in Urbino. So the particular characteristic of the native molecules and properties and chemical properties that are explained and demonstrated are mostly on the capacity of hyaluronic acid in binding water, as has been described previously by Carla, and also the capacity in accepting the reactive oxygen, protecting the body as a slight scavenger. And there are incredible applications because of the versatility of these molecules. And we will introduce some aspect of knee joint cartilage, muscle, ligament, and tendon in the application in regenerative medicine. And it is important to consider the molecular weight of these molecules. So just a point and the definition. So is considered a low molecular weight once that the hyaluronic acid is between the 20 oligosaccharide and 1 million Dalton. And once is higher in over 1 million Dalton is a high molecular weight. The presentation that will be completed with the other speaker of this morning is about the use of these molecules as infiltrative treatment in knee articular cartilage, ligament and tendon, and some previous interesting data on muscle that for me is some of the most interesting so far. But let's start with the proteomic analysis in synovial fluid in gonarthrosis and osteoarthritis has potential in improving the clinical data. So as again Capucina introduced, the proteomics introduce a new perspective in analyzing and evaluating the clinical data. So from mass spec and liquid extraction, we have seen histology guide laser microdissection data, so are very, very interesting. And we applied the basic proteomic approach in analyzing the modulation of certain proteins in the synovial fluid that has been treated in a condition of gonarthrosis with specific and innovative formulation of hyaluronic acid. We consider these longitudinal studies with a follow-up of 12 months, in which patient had a symptomatic mild, moderate gonarthrosis grade according to at the second, the third level good degree of the Kellen and Lawrence system score. We are collaborating with clinicians that are having these patients, and the clinician has an orthopedic and rheumatologist make the clinical assessment, the evaluation in the ultra sonography, and arthrosynthesis. We had as a samples a synovial fluid and blood sampling in these different times of treatment. In particular, the viscosupplementation regime consisted in these first studies in these two sequential intraarticular injection of the different hyaluronic acid formulation. It's interesting that the first is the mix of low molecular weight as the first injection, and the second is after a week with the different free cross-linked fraction of different molecular weight of hyaluronic acid. So high and low molecular weight, and the low molecular weight of this kind of hyaluronic acid is the linear. And the study considered the chondropathy of this patient in only in certain cases, where make also this second round of infiltrations with the same pathology. In this case, the study population meet the inclusion criteria, and we analyze also the phenotype of the patient. So in our case, it is very important to consider the habits, the level of physical activity, the ecosystem or the ecological aspect of this person, so they were a smoker or not. And behind and independently from actually the BMI and general level of physical activity, we had improvement in the clinical parameters, so the pain, the range of motion, and especially the volume or liquid that was in the arthrocentesis that was significantly reduced. And something interesting was the analysis of the type 2 collagen at the plasma level during the time, and we were focusing on the time they were validated in the terms of prediction marker. So in this case, we make a negative correlation with the type 2 collagen's plasma level and cartilage thickness. And it's interesting that patients also experience a mean increase in their medial cartilage thickness. So biochemical data. Both sampling plasma and the synovial fluid has an interesting response in the modulation of cytokines that were our target first. So biochemical data indicated that there is a promotion of anti-inflammatory effect in response of this time-dependent infiltration, and induce this chondroprotective effect in the subject, especially with a low grade of chondropathies. In the synovial samples, of course, the effect was much higher, the more significant, also because once that you take blood samples from patients, you have influence from flu, from season, and so on. So it's not easy because the association of chondropathy not always has a synovial fluid that you can analyzed, but these conditions are effectively in the synovial fluid of the samples that they were available. And the biochemical approach has a proteomic approach revealed that where the protein that were differentially expressed were such that are related with the decrease in related with the anti-inflammatory cascade response, or were upregulated the ones that were inhibitor of certain inflammatory cytokines. The same approach has been applied for another treatment that not considered the two sequential regime of infiltration, but like one shot, as the clinician like to say, and of infiltration of hyaluronic acid. And we were always interested in cytokine and cartilage degradation marker. In this case is again another longitudinal studies with a follow-up of 12 months, a patient with symptomatic, more or less the same inclusion criteria, but in this case we had one shot of infiltration with this formulation cross-linked the hyaluronic acid with this high molecular weight intercalated with the linear one. And we make with the clinician the clinical assessment, arthrosynthesis, and the biochemical marker. And again, the subject group was more numerous, but we had similar clinical data. So amelioration of the clinical parameters and biochemical data, very interesting. In directly as biochemical marker, we have seen at the limit of pharmacological effect of this hyaluronic acid. So it was quite impressive data in reduction of the inflammatory conditions. These markers that all we know also are interesting by the metalloproteases, also modulations. So just the first part. interesting is working behind the clinician and consider the biochemical approach that can really support the effectiveness of a certain treatment in this cartilage articular disorders, I can say. New insight on other aspect of applications in ligament and tendon. And in this case, we were interested in collaborating with clinicians for this Achilles tendinopathy and recovery for not only clinical data, but also functional. Also consider the viscoelastic states based on the response induced by peritendinous injection of linear hyaluronic acid. And we wanted to verify the action, of course, and promoting the progressive healing of these Achilles tendinopathies. In this case, the formulation was different, was just linear and multifractionated hyaluronic acid. And so 5 different fragments. And we had this experimental design in which the longitudinal studies was with 45 days, so it was very short, but in this case we had the clinical assessment in all these 4 times, so at baseline, after 15 days, after 1 month, and 45 days. The infiltration was a peritendinous infiltration, so that was guided by ultrasound evaluation. And we make the biological analysis only after 1 month, at the beginning, at the base level, and after 1 month. And the functional assessment was also interesting for the biomechanical point of view, because at the all time points patients were assessed for viscoelastic tone, stiffness, maximal voluntary isometric contraction, and pain level. And we also used this monotometer, has a myoton that was capable to measure and quantify the mechanical parameters of the Achilles tendons in this patient, also analyzing the bilateral health tendons. So in this case, the approach was really different from the clinical point of view, because we had also functional parameters. And were very interesting to consider the response induced by the muscle tendon and analyzing data under the functional point of view. And of course, back to the biochemical data, even here was really amazing. We were very impressed about the response in cytokine control, because it was really significant in the reduction of interleukin-1 beta and also the metalloprotease free. And so that is just how we can work together with the clinician for these applications and for muscle. That is something that is just a bit at the beginning of our studies, because we are very interested on muscle pathology, and we mostly work on that more on the glycosylated proteins and not on hyaluronic acid, but that was the focus of Ugo, so we bring here our competencies, and then we will speak also about with Professor Piero Sestili and the collaboration that we have that, of course, I thanks for the data, also for Fabio Ferrini. In this moment, we take inspiration by great work from a group of research that analyze how the hyaluronic acid can protect muscle stem cells. And here I had the pleasure to meet Bénédicte Cézot, that present her data in other occasions, but was absolutely very, very interesting how the muscle stem cells can produce hyaluronic acid, and in the moment in which the muscle is starting with the injury. And once that muscle damage occurs, stem cells produce and cool themselves with hyaluronic acid. That was something very interesting because we use our models, we use C2C12 murine myoblast, and considering this aspect was very inspiring, because we were working with clinicians with adding these molecules, and we are very curious about the mechanisms. And it's interesting how they can coat themselves with these molecules they produce, so hyaluronic acid, and they protect themselves from the inhibition induced by the inflammation signals that are in this niche. So we start to analyzing how the hyaluronic acid that can be added during the process of the classical historical model that we use for analyzing the myoblast differentiation, the C2, C12, but to analyzing really the cell differentiation and wound healing. So we start. Fabio, if I miss something, you can add some words. And so we verify during the control, we induced the classical myogenic stimulus with the serum withdrawal, and we had our myogenic index. If we add, choosing this multifractionated hyaluronic acid that has these different molecular weights that is blended from 2 to 1,000 kilodalton, we had actually a really nice data, promising data for a stimulus in inducing the myogenic process that is significantly improved. And with myoblast, we started to analyze the stressed conditions that have been so far tested for concentrations and for also the use of hyaluronic acid, because sometimes we have to be careful in not using an amount that can cover too much our cells, otherwise they can be simply inhibited because the quantity is the limit of a cytotoxic effect. So the percentage, in this case, we analyze the wounded closure in our myoblast, and the stress was induced by lipopolysaccharides and interleukin-1 beta, and also by oxidative stress. And as you can see, there is a really interesting protection by the hyaluronic acid that enhance the wound healing in myoblasts in these stressed conditions. That is so very, very preliminary data, but was interesting. I hope that Ugo are satisfied for this presentation. Even we are not yet in mechanism, but we will have the next presentation that will go further in cell-cell communication. So under the point of view, since we are working on health, and we probably are more interested in mechanism because our background as experimental biologists, but aging, and as Carla said, is something that we have to consider what we can do. And my attention, I want to focus on the cure and the attention of the phenotype of person and treatment to slow the progression of these musculoskeletal disorders. And what we can really consider is a strategy in trying to understand mechanisms, work behind the clinicians, develop strategy in which patients are the center's perspective for musculoskeletal disorder management, multimodal, multi-component, multidisciplinary approach, applied not only by pharmacological treatment, but also by a combination of available pharmacological, but also lifestyle intervention program. And that will be to put at the center of our work ourselves, as is the example of Ugo, that I hope for him 123 years. So from here. So I thanks my colleague from Urbino that are with me today, and I'm open to some questions.